We begin today's program with a chance to check in with Niagara's Medical Officer of Health, Dr. Mustafa Hirji. Dr. Hirji, signs point to the province extending the stay-at-home order to June 2nd as of right now. We haven't heard officially, but you're saying that's not long enough.
Well, I'm not sure I've actually said it's not long enough. What I have said in the past is if I were giving a recommendation, I would recommend 4 weeks, but I think how long it goes really will be dependent on conditions on the ground. My guess is 4 weeks is probably the right time, and we should reassess as we go forward. If the province does 2 weeks, it's definitely, I think, the right decision. And then as we get close to that point, we have to make a decision if it needs to be extended or not.
There's been a discussion about a 1,000 case benchmark provincially. Do you agree with that as maybe the deciding factor in ending a lockdown?
I think it's certainly a good deciding factor. I wouldn't say it's the only one. I think a key part is we need to get cases down to a low enough level that we at the local level can do really thorough contact tracing, and we're able to contain cases like that. I think if we bring cases down to 1,000, if the province is saying that with their look across the province that we can do that, that's great. But the other key important thing is that we need to make sure we have a downwards trend in cases as well. If we're seeing an upwards trend and we reopen, that's of course a recipe for disaster.
We were getting used to case counts here in Niagara, daily case counts over 100, but that's not been the case the last few days. That's a positive sign.
That's definitely a positive sign over the last few days. We have a streak here going of a few days where we've been below 100 cases, and we actually, I think we're as low as 49 cases today, which is good. The average cases we're seeing over time is coming down, which is exactly what we want to see, but I still think back to last summer where we'd have days of 0 cases. We had as late as September 3rd, 0 cases. We'd mostly had days with single-digit cases. We have a long ways to go to still get back to that point.
One of the solutions, vaccinations, and we're making great progress on vaccinations. Have we been able to mobilize those mobile vaccination units to get out to the shut-ins yet?
Unfortunately, we haven't been able to do that yet, and that's really down to not having the right vaccine for that purpose. The Pfizer and Moderna vaccine are really unstable. You can't really move them except while they're frozen. And of course, if you take a 10-dose vial of vaccine to a place, you thaw it out, you can't just use 1 dose and then discard the rest of the 9 doses. So we really need something like the Astrazeneca vaccine, which has been put on pause, I think, for legitimate safety reasons. So that's no longer an option. The Janssen vaccine, the Johnson & Johnson subsidiary, would be another good candidate, but I think there needs to be a review of the safety around that one as well.
Putting that Astrazeneca vaccine on pause is a big blow to the progress overall, not just in Ontario, but Canada as well. Now we're looking at the possibility of maybe mixing the brands of vaccines for the second dose, which is something we weren't considering until recently.
There is some science going on to see whether or not it works to mix those doses, so we'll be paying keen interest around that. I do think it's unfortunate we've lost AstraZeneca as an option, but I don't think it's critical. We've had far more Pfizer vaccine and Moderna vaccine given in Canada. AstraZeneca is it's an important niche, but a small niche. But losing it, I don't think is going to really affect our overall program too much. Where it really affects us is with some of these really, niche groups where we need to vaccinate, such as the people who are homebound, as we've talked about.
There's a big push on now to make sure that all frontline workers, including healthcare workers, have had their second shot.
Yeah, that's a new decision that's come down lately. The hope, premise we've been operating in the province has been that you get most of the protection from that first dose, and that second dose is really just topping it up and making sure you have protection over the long period of time. So this does unfortunately mean if we may slow down a little bit giving out the first doses, and they'll be a little slower to get to others. But I think we've made good progress so far. We're over 40% of residents now have our first dose, and hopefully we'll be able to continue making good progress.
Chuck Schumer, our neighbor down in the United States, is really pushing hard for a relaxation of some of the border restrictions right now. Is it still too early to approach that?
I do think it is. While things are looking a lot better in the U.S. these days, likewise they're looking better here over the last few weeks. Our case numbers are still high. The U.S. case numbers are still high. We still have more work to do on both sides of the border to get COVID-19 under control. We still have more work to do to get vaccination rates up. And I think you want to get both of those things done before you open the border. And then the last thing I think you want to make sure before you open the border is you don't have some unique variant spreading on one side of the border or the other that's going to then travel across that border. So I think we'll get to the border reopening later this summer. It's just not quite time yet.
Dr. Hirji, it's worth mentioning we've passed that 14-month milestone now of this pandemic. Thanks for continuing to communicate with us on what is happening with the virus here in Niagara during this time.
You're welcome. That 14-month feels like both an eternity and has gone by in a flash. Always happy to make sure our residents have the right information. Hopefully we won't be doing this for another 14 months, though. Not that I dislike your company and speaking to your audience.